I'm Rhonda Crossett. I'm director of the Women's Center at Henry County Medical Center. We are a fabulous place to have your baby or have your GYN procedures. The choices that we have give women options. We have 10 rooms on our delivery unit, and they are all what are called LDRPs, which mean you deliver, you labor, and you recover, and you spend your postpartum time in that room. And that includes if you have a cesarean section. If you have a cesarean section, you would have that in our own surgery suite that's on our floor, and you would recover in your room with your labor and delivery nurses. So you wouldn't have a lot of new people to get used to. You would stay in your room. When you have a vaginal delivery, you have your delivery in your room, and you will stay in that same room until you go home. So there's not a lot of moving your things around, and that is always good. Our physicians at Henry County Medical Center are phenomenal. We have 4 OBGYNs that deliver. They're board certified in obstetrics and gynecology, and that is Dr. Paul Locus, Dr. Pam Evans, Dr. Catherine Whitfield, and Dr. Dennis Wick. We have a great food service. We get compliments on our food all the time. And we have room service where anytime during 7 a.m. and 7 p.m., if you're hungry, you can pick up the phone and call someone who will bring you what you want to order so that you don't have to wait for certain times for the meals to come around.
We are trying to provide it to where we have a one-stop shop, for lack of a better word, to where patients can come in and be seen, be taken care of, not have long wait times, where we can draw their lab work, do their ultrasounds, all of that be done down here in the office, which Paris Women's Center now occupies the entire basement floor of the Medical Arts Building.
The clinic team is very strong. I'm excited to work with people that I know and I have known, people that I've worked with before, and with new people that I've met that are a huge asset, I think, to the medical center here.
We'll be glad to meet people. We do that, frequently, that they'll come and want to just meet us before they decide to come to us. And I think that's one of the biggest things, talk to their friends and family about who they're seeing and find out, how the practice runs, what kind of, personalities the doctors have got, and that they can, be comfortable with.
I'm really excited to be working with Dr. Dennis Wick and Christian Elliott, and of course with Dr. Pamela Evans, who's been in this community before. I know everyone's very excited to have her back, so just kind of the overall excitement about building this new team, the Paris Women's Center.
In our Women's Center, our goal is to give you the best experience delivering your baby and having your family there as possible.
I opened my practice, Paris Pediatrics, in 1992 and began providing care. My practice grew rapidly, and now I have a separate building on Jim Adams Drive and 2 other pediatricians and 2 extended providers providing care to the children of Henry County and the surrounding counties. Pediatricians at the end of their medical school do an extended training in the care of infants, children, and adolescents. That training lasts 3 years, and at the end of that 3 years, you take an exam proving that you understand and have knowledge of the care of pediatrics. If as a parent you go to a pediatrician, you can be sure that your child is seeing somebody who is specially trained in the care of children and their illnesses. When you walk into an urgent care or a fast access care or an emergency room, you're seeing a physician who completed the 4 years of medical school, but who may have no interest in pediatrics and pediatric illnesses. So to get the best care, you are best served by seeing a pediatrician.
My experiences with Paris Pediatrics have been nothing but wonderful, really. I remember very clearly the first visit that we brought Scarlett to after she was born, and just the way that the nurses and Dr. Selby interacted with Scarlett. It was clear from the very first moment that they were there because they love kids.
Pediatricians, by being well versed in the care of children and building the relationship with the parent and the child over time as the child grows and develops, are often able to spot a problem before even the parent notices it. For instance, one Sunday afternoon, I was called in to see a child who was 10 months old with a fever. And while I was examining her, I thought, her head doesn't look like it used to look. And noticed and pulled up on the growth curve and found that she actually had craniosynostosis, which would have been devastating had it not been noticed. In an urgent care setting, that child's fever would have been treated and she would have been dismissed. Paris Pediatrics is a very busy practice. We've been there for 26 years. I am now taking care of my grand patients. Patients that I cared for 26 years ago are now parents, and it's so rewarding to be able to reestablish that relationship with the second generation and to know that I already have the trust of the parents when I start that relationship. And over time, as that relationship builds, because we follow kids from the day they're born until they're 18 or 19 years old, you learn what that child is all about, and you have an actual relationship where when you see them on the street or at the ball game, they talk to you and they want to talk to you and they want to have that friendship with you. You're not just their provider, you're their friend. And I think that makes being a pediatrician and choosing a pediatrician even more important.